Okay. Hello and welcome everybody to our third webinar this year. We're timing this webinar to go with the delivery back to all of those schools that have did the student survey in the autumn, and that you now have your student health and wellbeing report. So we certainly hope that you've all received them. So if you've had an issue, then do please get in touch. But we're really very happy to welcome you here today. In a moment, Mike, who is our wonderful technical advisor, is just coming to do something. And yeah, so we have a camera. That was what was missing. Yeah. So you'll recognise Hannah Littlecott sitting next to me because she presented on breakfast. She's her PhD informed some of the reports, so we're going to talk about that. And there is an unseen person, Dr. Graham Moore, who will be swapping seats with Hannah, and who's going to look at interpretation of the reports, so some useful advice to schools there. So I think if I just push this next button, I can just explain a little bit, just to say what it is that we're covering. So Hannah Littlecott did a survey when we sent out the first round of reports, and some interesting findings which we're going to share with you. And I'm going to just chip in and say what we've done as a result of some of the things that schools told us about that. And then, as I say, Graham's going to join us. There's an opportunity for you to type at any point, which will appear down the side for us to see. So you can do that at any point. At 2 times we will open the microphones, and if you are interested in speaking to us and asking questions, if you look at the top of the screen, it should say interact. If you go down, there's a drop-down list, and hands up is one thing that you need to press, and then we'll know that you'd like to speak. So I think without further ado, I shall pass on to Hannah to talk about her information.
Okay. Thanks, Joan. Okay, so as part of my PhD, as Joan said, I conducted a survey of the 2014 reports. And this was both online and paper, available in English and Welsh, and some of you may have completed it. And so I sent an email invitation for people to complete it online, and then followed up at the summer events last year and asked people to complete it there. Afterwards, I conducted some statistics just to get the results.
Perhaps if I can just chip in and just say, obviously, we've done another round of recruitment since then. So if you're thinking, well, I didn't get a report in 2014, it's because it was just the people that joined initially. Okay.
So the survey covered topics such as whether schools had received and read and discussed the report, whether they perceived the report to be useful, and what the perceived barriers to using the report were, and whether they perceived that they needed more support to interpret these and to take action from them. So I got a response rate of 34 schools out of a possible 69 members at the time. As Joan said, that's since grown to more than 111, I think.
115 now.
115.
So, yeah.
But these 34 were representative of Shern in terms of the mean number of students, the percentage of free school meal entitlement within each school, and the language medium. And the roles of people filling them out consisted of either senior management team members or wellbeing leads, or people who were assigned to both roles within the school. So I'll go through the results briefly now. So I asked whether schools had received and read their report, and of all respondents, 73.5% reported that they had received their report. A further 54.3% reported that they'd read all or most of it, and 14.3% reported that they'd read some of it. So that was fairly good coverage of the schools there. And then there's the effect of being a member of the senior management team on whether they received the report. So actually, almost all who were part of the senior management team reported that they had received it, whereas those who completed the survey who were wellbeing leads, and actually slightly less of those had actually received the report. And of the 4 wellbeing leads who reported not having received the report, none were actually members of the senior management team as well. So it really kind of highlights the importance of the involvement of the senior management team and support from that level. And within the schools that completed the survey, responsibility for interpreting the report was held by the head teacher in 33.3% of schools, deputy head in 46%, and the wellbeing lead in 50%. And obviously there are some overlaps between those roles.
So yeah, so just some learning from that we were able to act on for this round of survey was the first time we were actually sent out the reports to the head teacher, and I don't think quite realised just how many emails head teachers receive, and so that sometimes I think it was either deleted by mistake or it certainly didn't seem to get through the system, so that caused problems. So this time we asked to send it to the main contact, our main contact for the network, and hopefully that will that seems to work a lot better. And we are also at the summer events this year, we're going to talk about an intranet aspect of our website that we think will be a really good way, because the one thing we have found this time is that just due to some of the vocabulary in the report, some authorities' blocks have prevented it going through. So that will hopefully help that. And we'd sent it out at the end of the summer term last time, and people told us that really they needed it at the start of the summer term. So we did send it out the first week of this term. So hopefully those have all been good. But if you've got any comments, then just let us know, and we'll try and act on them for the next time.
Okay. So there was also an effect of the senior management team membership on reading the report. So almost 70% of respondents who were part of the senior management team reported that they'd read all or most of the health report, but only 43.8% of the wellbeing leads had reported the same. So again, highlights the importance of the involvement of the senior management team. Further to this, among participants who had reported to have read at least some of the report, all of them perceived the report to be potentially useful as a planning tool for health improvement, which is a very positive finding. I then moved on to ask whether schools had discussed the report with several stakeholders, including parents, students, other colleagues, outside agencies, school governors. And actually nearly 70% of participants who'd read at least some of the report indicated that they distributed the report to their colleagues, and a further 21% reported intending to do so. But for most of the stakeholders, so the outside agencies, the students, the parents, etc., there was a higher percentage of participants reporting that they planned to discuss the results with those groups rather than that they had already. So although there was a really positive kind of attitude to that, so wanting to share the results and engage with stakeholders, that hadn't actually happened yet. But so that was a really, really positive finding.
Yeah. And I guess, was it in some cases, would it have just been the timing of when they completed the survey?
Yeah.
Maybe it was quite early
exactly.
on in the process.
Some received the report at the end of the summer term and then completed the survey in September, so they didn't really have much time. So also I asked about the barriers that schools perceived to using the report, and the top three those that were rated the top three were funding, time, and staff buy-in. With the other possible choices being things such as the issues included in the report, it being difficult to read or interpret, lack of advice from outside agencies, and buy-in from students, governors, and parents. So we were just wondering whether you had any ideas about how schools could overcome these barriers, because often, obviously, they're seen as quite important factors.
Yeah, and I just think it would be really useful, and so we are going to open the microphones if anyone would like to talk and offer an opinion. I'm aware that not all of your computers will have microphones, so you may not be able to do that. But if you want to type anything, then do that, because that would be really useful. Perhaps if we can just start. I mean, the funding element, I'm guessing, because obviously there is no cost to actually being part of the network, and we do the survey and the reports, there's no cost there. But I guess it related to actually using money to put some things into action. So just some thoughts that I had was that obviously if we're encouraging actions, then maybe we should be looking at actions that have a sort of no cost, certainly financial cost. And certainly sort of sharing it and getting people's views within the school, both students, staff, and family, community, governors, wouldn't have a cost there. I mean, time, I am so aware when I'm contacting you all in schools, you are very, very busy, and there's so many competing priorities, and so that's hard. And so, I suppose it's just having wellbeing very high up on your priorities, really. I did think for staff buy-in, I just suddenly thought, because we've actually just had a school where our contact's gone on maternity leave, and then the person who's taking the role really didn't know about the network, whether we should actually put together a little PowerPoint presentation, which is what we did for the report when we were doing the electronic report, so that maybe at least then the bare bones of what the network's about and what we offer could actually, be shared quite simply within school, or maybe with the support of the local healthy schools coordinator. Unfortunately, with 115 schools, much as I'd love to come and visit all schools, I don't think I would be able to do that. But that may be the case. So do keep thinking that you can write down any suggestions, and we can pick them up as we move forward. There's some interesting points.
And so, moving on to the perceived need for support. So, all of the respondents in the survey, out of all of the respondents, nearly 50% reported that they were likely or very likely to need more support to use the report. And whereas 35% reported that it was not likely or not at all likely. So there's quite a large percentage that actually would like more support there. Out of all the respondents, there was also a high overall confidence that the reports could act as a catalyst for change within their school.
That's great to hear. Yeah. And again, we have done a bit of listening to that. So we did implement training for healthy schools, local authority coordinators, and hopefully, they'll be there to support you in looking at your reports. We did a tips for interpretation that was sent out with your reports. So if you didn't pick that up, just, you can go back and look at that. We're running this webinar, and the other aspect of the report about how schools are using their report that you will all find useful, we've been feeding back both in newsletters, the last summer event, and definitely this coming summer event. I did have a think that maybe because it's buried in all the newsletters, that we'll pull them out and put that in a special place on the webinar, so it's easy for you all to access. So that I think will be
on the website.
Thing. On the website. Did I say webinar? Yes. Sorry.
And also to add to that, at the moment, myself and some colleagues are putting together a bid for funding to create more of an infrastructure around that and create more support for sharing schools. So that's just one to watch. So
yeah, no, that I think was really exciting. So we're looking forward to that. So I think, can I just thank you very much, Hannah? You're
That's
becoming
okay.
an old timer in here. We'll have to see what else we can get you to do for a webinar. But thank you so much. That's great. Okay. So I think there's going to be a swapping of seats for a little while, just while Graham comes to join me, and then we can continue on. So, hi Graham. So Graham's going to talk about interpreting the reports and just any thoughts and ideas that he has. I don't know if you just want to explain what your role in Decipher is.
Yeah, I'm a senior lecturer in Decipher, which is where Shern's based, and I'm part of the academic management team for Shern as well.
So I'm very supportive of the network. So yeah, so if you want to press the next, so you just press it there. That's it. Yeah.
Okay, so I'm just going to be talking through some of the issues in actually interpreting and making sense of making sense of the data, so that you can use it for school health action planning. So you'll have all received your reports, which look a little bit like this one. This is a kind of mock report, so this is a completely made up school. So we're not giving away anyone else's confidential data here. But we're just going to use some figures from this mock report to illustrate some points around interpreting the reports. Some of the issues I'm going to talk about are things like how to interpret low numbers. So we've got a low numbers table within the report, which kind of flags up areas where we have to be a bit careful about interpreting things. Also the importance of paying attention to what the question is that's being asked before interpreting the figures. And finally, some kind of issues in actually making comparisons between the averages within your school and the national averages. But before I do, I'll just give a brief overview of the survey we actually conducted. Last time around in 2013, it was basically the health, behaviour and school-aged children survey that we used for the Shern reports, and that involved sampling one class per year group within about 80 schools. So within that survey, we had about 8,000 participants, I think. This time round, we asked schools to put as many pupils through the survey as possible, and we had a really good response to that. So we had about 87 schools completing the survey. And on average, those schools put through about 400 of their pupils. So I think on average, schools were putting through about 40% of their pupils. So we've actually ended up with a huge data set, about 35,000 students in it, which is really useful, both because it means that the more pupils we have within a school completing the survey, the more confident we can be that the averages we're presenting represent that school, but also that huge sample gives us a lot of data that we can use for looking at national trends as well. Another big change from the previous survey in 2013, HBSC is limited to 11 to 16-year-olds, so the course years 7 to 11, whereas this time around we've included sixth forms within those schools that have a sixth form. There are also some added topics around sexual behaviour and drugs, which were kind of optional topics. Sexual behaviour was only asked of older age groups. We've also included some new questions around psychoactive substances, violence against women and sexting. There are also some new questions that were put in specifically for research purposes, which haven't necessarily gone into the reports, but things that we'll be using for national trend analyses around sport participation, food black markets. Just press it on.
Yeah.
My technological abilities are letting me down. So I'll talk about within the reports on one of the, is it page 3? Quite early in the reports, there's a low numbers table, and that basically flags up where within any given chart, if any bar in that chart is based on less than 5 pupils responding. And that table can help you, it kind of acts as a bit of a red flag to indicate that you need to take care in interpreting those data. Because the denominator for calculating those figures is always the number of students who actually answered the question rather than the number of pupils within the school. So actually, if you see a very high percentage, but that's based on a very low number, then that probably means that very few children actually completed the report. Completed that question. Having a low number within the bar actually becomes less problematic when you have a very high very sort of low percentage within the bar. So, for example, if you if your bar indicates that the percentage of young people who've tried cannabis is 2%, but the figure is only, but that's based on only 1 to 5 pupils, then you know that at least 50 pupils have actually completed the question. So if you see very low percentages based on low numbers, then that means that the denominator must be quite high. So it's only really if you see it's flagged up as being a low number of pupils and the percentage is very high that it's a problem.
Yeah, I think that's useful to spell out.
Oh,
Sorry.
Keep pressing the wrong button.
Sorry. I could do it.
So an example of this, if we have a school in which there are 60 boys in year 10, only half of those boys, so 30, take part in the survey, and for some reason only 8 of those 30 answer the question on bullying. If 5 report that they've taken part in bullying at school and 3 that they didn't, then the percentage within the graph would make it look like bullying within the school was very high. Our percentage would be 63%. But we can't really make any assumptions about how representative those 8 pupils are of the 60 pupils within that year group as a whole. So it could be that as little as 8% of pupils take part in bullying, because it could be that all of the other pupils who didn't take part in the survey would have said no. So in those instances where very few pupils have actually answered a specific question, you have to interpret that with quite a lot of care, and that hasn't happened that much. Some of the later questions in the survey, there are some schools where there were time issues or issues with IT, which mean that fewer children actually completed those questions than some of the questions that were earlier on in the survey. For the most part, I think about 95% of pupils who started the survey actually made it all the way through. I went to press the arrows again. I will learn at some point. I need a little electric shock or something to condition me into getting it right. There are also quite a lot of charts in the reports that are based on only a subset of students. So they're based on only a small proportion of the students who actually completed the question. So for things like age of first use of cigarettes, age of first drinking or cannabis use, those figures are based on year 11 students only. So really what those graphs represents are kind of age of initiation amongst 15 to 16-year-olds, because really if we were to include the entire sample, I mean, obviously a 13-year-old could only select 11, 12 or 13. So your figures would be somewhat skewed to the left because those younger pupils would only have a small number of figures available to them. And there are some others around, like frequency of cannabis use, for example. The denominator there is the number of pupils who could say that they do currently use cannabis. So rather than the whole sample, frequency of cannabis use is only calculated amongst young people who do use cannabis. So just to illustrate, I've done that with every single slide so far.
Graham has a young baby. I think that might explain.
You don't have to make excuses for me.
Yes, there we are. Just being nice.
Okay, where was I? So the number of days in the last 30 days on which students have taken cannabis. So actually, if you were to just look at this without kind of taking into account the fact that this is just a subsample, it would look like cannabis use was very high. Because we say that 52% of pupils, 52% of male pupils have used cannabis 3 to 9 days after the last 30. But this is actually only amongst those pupils who say that they've used cannabis at least once. So to kind of put that in context, you have to look at the percentage overall who have used cannabis. So here we can see that actually only 4% of boys and 2% of girls have actually used cannabis at all in the last 30 days. So actually the percentages on the previous slide are based on only 4% or 2% of pupils. So the percentage of young people who are using cannabis every single day isn't 5% overall. It's 5% of that 4%. So actually the number of young people using cannabis every day is pretty low.
Yeah, that's good.
It's also useful to be really aware of what the question is that the survey that's represented within the chart. And actually a lot of our questions we've taken straight from the HPSC survey, and that's largely so that we can track trends over time. But sometimes those questions don't map on perfectly to public health recommendations. So if you take this as an example, this is the percentage of boys and girls who were eating fruit and vegetables at least once a day. And if you just to look at this on face value, it looks like lots of young women in particular are eating lots of fruit. So 3/4 of young females are eating fruit and vegetables at least once a day. But actually, the recommendation is 5 or more portions a day. So we don't know from these data how many young people are actually meeting public health recommendations. We just know roughly the percentages who are kind of eating at least 1 or more portions a day. So this allows you to kind of make comparisons by gender and across ages and to compare your data with national averages, but actually you could still be falling a long way short of public health recommendations, even if the figures are quite high here. Almost did it again. Stopped myself that time. I'm learning. It's a slow process. And this next question is around life satisfaction. So students are asked to respond on a ladder, a scale from 0 to 10, how satisfied they are with their life. So with some of these questions, we've had to make a decision around where to set the cut point. So for this one, this is the percentage of students who are giving a score of 6 or above. So students who say 6 to 10 are assumed to be relatively satisfied with their life. But actually, the percentages that you see in the chart would differ if we chose a different cut point. So to a large extent, the percentages you see are a function of where we've decided to cut the data. So again, it allows you to kind of make comparisons between genders and comparisons across year groups and see which genders and year groups are more or less satisfied with their life. But the actual percentages in themselves could go up or down depending on where we chose to use as a cut point within that scale.
I just wonder whether it's worth asking for schools to sort of dig under that data. So for both of those charts, with the fruit eating and everything, do you have any thoughts or recommendations as to what they might do there? Or
sorry,
I'm just saying, because obviously there, it's a big cut off. Would you ever recommend a school looked at some other questions that maybe that all in talking to the students in smaller groups or anything about sort of life satisfaction or about any of the other issues on any of the charts?
Yeah, the main value of these kind of data, I guess, are that they allow you to identify where the problems lie. So if you do within this chart, for example, this is the percentage of young people who say they're satisfied with their life. In year 10, it looks like you have really quite high levels of satisfaction, particularly amongst boys. There does seem to be quite a dip amongst year 9 pupils, and there also seems to be quite a dip around the time of the transition to secondary school, particularly for boys here. So it might be that you'd want to focus attention on improving well-being in those subpopulations within the school.
Yeah, no, that's useful.
Okay, I'll skip that one actually. These are kind of age of initiation questions, and these kind of suggest that for this school, the age of initiation of drinking is slightly lower than the average because the figures are slightly kind of skewed to the left. Looking at national average figures, most young people start drinking at the age of 15, whereas in this school, the peak is at 14 years old. So on average, pupils are starting to drink about a year younger than the national average. And it is a useful thing to be able to do, to be able to compare how your school is faring against national trends. But there are some risks of doing that. Just to present some kind of national trends, sort of all Wales level kind of public health priorities. And just with a slight health warning, because these were figures that were pulled out while we were still cleaning the data, so they might have changed a little bit up or down. I haven't corrected them. They suggested about 18% of 11 to 16-year-olds were sufficiently physically active. About 14% of 15-year-olds reported that they were currently smoking. And about 9% of 15-year-olds report current cannabis use. So quite problematic prevalences at the national level, but those things do vary very much by school. So if we look at how much those things vary by school, physical activity, in terms of physical activity, between about 7 and 30% of young people within schools reported that they were that they were sufficiently physically active, so taking part in activity every day. So you could be at the very top end of that spectrum, but that still means that the vast majority of pupils within your school aren't sufficiently physically active. So it might well be that all schools need to invest more effort in supporting children's physical activity, because even the schools that are doing the best, there are still lots of pupils there who aren't sufficiently active. But things like smoking and cannabis use seem to be very concentrated in certain schools. So smoking in some schools, amongst year 11s, almost half of young people still smoke, whereas there are a lot of schools within our data set where not a single pupil responding to the survey said that they smoked. So it might be that some efforts to kind of reduce smoking rates need to be focused very much on specific schools where smoking is still a problem, and that actually trying to intervene to prevent smoking in some schools would be a bit of a waste of resource, because smoking just isn't an issue in those places anymore. So some issues, as those figures kind of illustrate, some issues are really pertinent to all schools in Wales, but to a different degree. So in all schools, a minority of young people are sufficiently active. A minority of people are sufficiently active. So regardless of how far above the national average your data in the reports show that you are, there's still a lot of room for improvement. So just because you're above the national average doesn't mean there isn't more to be done. But there are other issues that are very much concentrated in some schools. So smoking is still very much the norm in some schools, but pretty much eliminated in others. I mean, some of the other kind of caveats I'd say around kind of comparing school level data to national averages, it's not all of that will be a result of things that schools do. And there's a bit of a risk of kind of league table thinking, if you like. What students bring into the school with them, the kind of the cultural, we know that kind of in educational terms, the kind of cultural capital that young people bring into the school environment with them will often determine how well they do at school to a larger extent than anything that schools themselves actually do. And that's very similar, there are similar issues in relation to some of these health behaviours. So for things like smoking, for example, we know that the biggest driver of whether young people are likely to take up smoking is whether their parents smoke. So if you live in an area where there's a huge prevalence of adult smoking, then the likelihood is that you will have lots of pupils within your school who smoke. And that's not necessarily because of anything that's going on within the school setting.
Okay.
But we do know that there are effects of schools. Some of the things that schools do can have effects on young people's substance use, young people's emotional well-being, and actually the practices that do take place within schools already are kind of highly variable. The schools will already be doing some things that do work. So even if it's very unlikely that anything schools do will ever completely eliminate the differences that are present between schools in terms of the health and well-being of their pupils. But even if gaps are always going to be there to some extent, there is quite strong evidence that schools can do things to play a role in narrowing those gaps. Okay, I think that's
right. Oh well, thanks, Graham. I think that is really interesting and very thought provoking. And I think some of you may want to ask some questions. So again, you can type away. And thank you for those that have been typing away. And I'm sorry to hear that one or two people had some problems actually joining us. But you can again go to the interact button and put your hand up, and we can actually speak to you. But otherwise, if you want to type any questions for Graham, then please do. I just had a couple of thoughts as we were talking.
All attendees are muted and may unmute themselves by pressing *6.
I don't know if you all heard that or if that was just us, but I think you did, yes. So I just think with all of those, I mean, obviously it's really valuable, and the schools have told us that you can look at the data and work out, you know, what sort of actions that you might want to put in place. But I think I'm a great believer in positivity, and I think it's lovely to hear when schools actually really celebrate, you know, where they feel they're doing well, and I think that's you know, it's a good health promotion positive message to do that as well. So that's just one thing. And if we're just waiting, if there's anybody else, the sort of link, perhaps people don't know about the HBSC, the Health Behaviour in School Age Children Survey, because that's an international survey, isn't it?
Yeah.
So at some point, you know, people will be able to compare some of their own school data maybe with other countries, which may be something that might interest some schools. So,
yeah, it's 44 countries, I think. HBSC.
Yeah. So that might be something we can look at if people are interested in the future. So I think maybe we'll certainly keep the you know, anyone, if you want to speak or to write a question, you can certainly do that. This perhaps is a good time to say that we will be looking, you know, we're going to run some summer events, and we will be talking about some of these issues there, but you can always email me and I can ask Graham or anybody else if there are any queries that you want answering. So I think we'll just go on, and I don't know if I'm quite on the thing, just because it's just a great opportunity for me to share some network news. And I think the first thing I just want to say is just a huge thank you, well, obviously for those of you who joined us, to thank you for you know, doing the student survey, and really hope that your reports are good, but to thank you for completing the school environment questionnaire, because we do have the majority of those back now. And you know, I just think these will provide valuable data which will go alongside the student data, and so thank you for that. If you haven't, if there's anyone here, then we'd love to receive it as soon as possible, and if there's any issues, just get in touch. Right, okay, so actually we do have a little a point there, so perhaps we should just, before I go on, right, so that's great. So Catherine, Jarrett, Kate, you've been sharing it with staff but not pupils. So oh right, so that's good. So the staff saw potential for using the findings with pupils. Any suggestions for parents? Well, that's an interesting one. Yes, I think it is something that we thought we might look at the summer event, just to talk about what schools feel would be appropriate. We touched on it last year, and there was a slight concern that, you know, if you shared the data and it was negative, what implication that might have for your school community and parents of the school. But I think that might be something that we certainly will be looking at some point, and possibly this summer. So thanks for that question. I don't know whether, Graham, you have any thoughts on you know, the role of sort of families in relation to this data.
I think that's very much something that we kind of leave up to schools, because the schools are kind of own that data themselves then, don't they? And
yeah, no, absolutely.
There are kind of risks, like I was saying, of kind of league table thinking, I guess, that if schools aren't performing well in certain areas, then that could be sort of blamed on things schools are doing, when it's not necessarily anything to do with schools' actions. And I think it's really, I think we need to leave it up to schools to decide whether it's appropriate to share the data with parents.
Yes, I mean, I think, you know, that's true of all aspects of this data, but we can at least share sort of practice. So if a school has found that something that's helpful and useful, we can perhaps look at that. But yeah, no, I think that's that's certainly worth it. So that leads us quite nicely on to just the fact that the summer network events, we're going to be running one June the 16th, and we do the short days 10 till 3 to allow people to travel, and so that one's up in Llandudno, and then on June the 23rd of June we'll be at the Orbit Centre in Merthyr Tydfil. So it'd be great if you can come we'll be looking at all sort of aspects of the network. But I know that the sort of networking and chatting to other schools was perceived as being very helpful. I've just picked out just a couple, 3 little quotes from the summer event last year, and as I say, I think those who've come have always had a good time and found it beneficial. So we hope you'll be joining us this year. We'll be sending out more information. We sent it in the newsletter, but we will obviously be sending sort of invitations that you can register. A few of you have, I know. As a point in that, we do think it's really good just to share good and interesting practice with what people are doing with their reports. So, if you feel you've got anything you'd like to share, it can be just quite a short sort of 5-minute presentation or a little bit longer. There'll certainly be lots of informal chatting, just because, this is so new and we don't, it's nice to be able to sort of pick up from other schools what they might be doing. So we'll hopefully be looking at that. And finally, we are really keen, and still, although we've run 3 webinars this year and we ran 1 last year, it's still very new to us. And so any suggestions that you have in terms of webinar topics that you'd like in the future, we'd really like to know, and just generally what you think about the webinar as a way of, communicating with you. I know it's just hard to get people out of schools and the cost of travel and everything. So if you could do that, that would be brilliant. Just one other thing that I just literally had an email today about is that obviously we're based at Cardiff University, and Cardiff University alongside the WJC are looking at a Welsh Back conference, and I think it's in July. So if any of you are interested, just email me and I will send you the link if that's your area, or if someone in your school is interested in that. It would have gone in the newsletter, but I didn't hear about it until afterwards. So thank you very much. Perfect timing again. So I'd really like to thank Hannah and thank Graham. And if there are any questions that have come up from this, then do let us know. I know somebody did type, and I think Mike just typed back to say they'd had some problems. So just to reiterate that this will be up in the, it'll be on the website. So if you missed any bits, you can sort of catch up, or if you want to share it with anybody else in the school, then you can certainly do that. So thank you very much. Thanks for joining us at such a busy time of your term. Okay, thank you. Bye. Okay, can you speak?
I can't see.
Where's it got to? It's just over.
It is.
Oh, there we are. There we are.
Sun comes out when